Well, hello, everybody, and welcome to Early Childhood Discussions, where we have conscious conversations about early care and education topics with early childhood champions. This podcast comes to you from the Grow New Jersey Kids Technical Assistance Center North, part of the Central Jersey Family Health Consortium. Today, Stephanie and I are joined by our very own Eve Robinson, Program Director of our Technical Assistance Center. Eve was the first person hired for this new department and has been witness to wonderful changes and moves toward greater quality for children when programs participate in Grow New Jersey Kids. In spite of the challenges our field is currently facing, Eve has many reasons for hope for the future of quality childcare in New Jersey, and we are really looking forward to today's conversation. So Stephanie and I are co-hosts of this podcast. And Stephanie, welcome back. If you want to just introduce yourself and tell our audience a little bit about your background for those folks who may be hearing and meeting you for the first time.
Yes, hi everybody. My name is Stephanie Boyson. I am a senior technical assistant specialist for Grow J Kids. I started out in the beginning of this whole Grow J Kids process myself as a TA, and I now supervise a group of wonderful TAs that work with family child care providers and child care centers. And we're so excited to have Eve on this call with us today.
Well, I'm excited to be here.
Yes, we're so happy to have you, Eve. And I'm Lori Hargy, Special Projects Manager with the Grow New Jersey Kids Technical Assistance Center North. And I work to support our whole team in operationalizing the special projects that we have. We work as an amazing team to provide lots of helpful resources for people who have made the very vulnerable decision to look at their early childhood programs and work with us as a team to make them even better. So, Eve, we are so excited to have you today. Thank you for joining us.
You're welcome.
So, Eve, I'm curious. We've known you for many years, and we've heard you talk and be passionate about so many different things, from early childhood to your community, et cetera. And I'm just wondering, what was that one moment or that spark that, changed the trajectory of your life? Meaning professionally, personally, what was that thing that landed you in your role today? If it's one thing, a situation, what was that? What is your why, and what was your spark?
Yeah, it's a good question. I grew up in a family that was very involved in the community. So my father was a pediatrician. So he served children and families for as long as I knew. And my mother was pretty much a community activist. So, you put those two things together, and I wanted to find a place in my life that worked. So I did work. One thing that sparked me was I did work in my father's office. His office was in our home. So I think the other piece of that is that my whole life, children and their parents were coming up our front walk and walking into our home every day. I mean, it was separate, but still they were right there on our front porch. So I saw firsthand interactions with young children and with their families. So I wasn't sure where I fit in, but I certainly thought that that's the direction I should go. I was pretty much motivated and inspired to go that way. And interestingly, when I was in high school, I was able to do what they call a senior project. I think today a lot of schools have what's called a senior project. When you're a senior in high school, you can choose to work outside of school and get an experience and then come back and report on it. And I was able to do that at a child care center in Trenton, New Jersey. And this child care center was part of what was in the 60s called anti-poverty programs. In the 60s, we had something called the War on Poverty. Unfortunately, the War on Poverty was overshadowed by a real war that was taking place in Vietnam. However, a lot of early childhood initiatives got started during that time, and one of them was childcare. As you know, Head Start got its start at that time. This was not a Head Start, but it was a child care center. And I went there to work, and that really was an inspiration for me. I had no idea how to work with children in groups. I had never seen that happen. And here's the one little thing, Stephanie. When I was at that child care center, we went outside to play, and one of the children found a worm, and they all were screaming, ew, ew, ew. And I was brave enough to walk over and pick up the worm and show it to all the children. And I was surprised at myself that I did it. But I think it sparked in me a realization that I could go beyond and really reach people if I stepped outside of my comfort zone, which was not to touch a worm. So that was, I think that really got me started.
It's so interesting to hear you talk about, your parents and their passion around what they do. Your mom being an activist, your dad being a pediatrician, and you saying to yourself, where can I take some of that and put it into my life? And I'm sure that has stuck with you up until now, right? I'm sure you speak about your parents very highly. I'm sure that bleeds into everything you do.
Yes, it does. And, it was unfortunate that my acumen in science was not up to becoming a medical professional. When I first started, I thought I would be a pediatric nurse or a pediatric nurse practitioner, or gosh forbid, even a doctor. I don't think I ever really thought about being a doctor. So I thought I would try that, and I was not very good at chemistry. I'll just admit it right here and now. Chemistry really baffled me. So science was out, and so when I was in college, I thought back to that child care center, and I just give you another little tidbit of history. There was no such thing as studying early childhood education when I went to college. I went to a very large state university, not Rutgers, and they had no department of early childhood. The only way I could study early childhood or human development or child development was to make up my own major. I had to make up my own major because early childhood was in home economics, is what they called it. And if you wanted to major in home economics, you couldn't take other like BA level liberal arts courses.
Wow.
So it was really confined. Yeah, really confined. So I think I got motivated, Stephanie, by that. I got motivated to say, wait a minute, there needs to be a bigger place here for even in academia and in the community for young children and studying them, working with them, all of that.
The one word I thought was trailblazer, because you clearly had that in your mind of, wait, there's something missing here. And I feel like that's very early childhood of you. We're all trying to be those trailblazers and create new paths for people. So I just love that.
Yeah.
Yes. And I really connected with that emergent curriculum aspect of the worm. And it just brought me back to my first early childhood experience, which also was so career shaping for me. I was early in my college years working at a childcare center in New Brunswick, and Shamanda found a worm and we named him, and he became our little classroom mascot for the day. And yeah, how those little tiny moments can really set you on the realization that this is what I want to do with my life.
Yeah, isn't that something? That it was a worm as well, and there was another piece too, which was all of the people who worked there were from their community and lived in their community, and I got to know them, and I had an experience of a work experience, and that too was motivating to me. I saw teamwork in action. I saw, the teachers and the assistants and the person who worked in the kitchen, and there was a whole array of staff there, and I really enjoyed that aspect too, of seeing what camaraderie there was in early childhood settings.
Oh my gosh, Eve, you just brought up the most important word of how programs can successfully get into and participate in Grow New Jersey Kids. That whole idea of teamwork.
Hmm.
I mean, there's nothing more important
Yep.
than that strong team that is seeing Grow New Jersey Kids as something that they're going to achieve together.
Great. I have that on my list of things to say, so you said it just as well. But that's where I got it from, was my first experience in a child care center. And, I went on later to recreate that in other places, but that's where I found it. And I was only 17 or whatever. And it's interesting because I can't remember another thing from being 17. Let's be honest. How many things do you remember? And memory is a very tricky thing. And oftentimes we remember the most traumatic types of things that happen. And perhaps the picking up of the worm had some element of trauma for me because I remember it as clear as day. I remember it picking it up, and I remember the feeling of that I accomplished something in front of these children. So it's funny because I can't tell you another thing about being 17.
Now, your early professional years weren't just limited to New Jersey. From what I recall, you were in multiple states doing the work. Can you kind of summarize those early years for you in your professional life?
Yeah, sure. Because my professional life actually has spanned several different fields. So I did start out in early childhood. As I said, I made up my own major in college. But after college, and I was living in Madison, Wisconsin at that time. So that was Wisconsin. And I will say that the experience of being at the University of Wisconsin also connected me to activism. So I always had a connection between whatever job I was doing, whatever field it was in, that I had to be an activist because that's what I experienced. So I moved to Boston and I wanted to become active as well. And that was when I went through the what should I do with myself phase, and I did get enroll in a early childhood program. I finally found an early childhood program. I finally found, as Lori knows, Wheelock College, which was it was founded to be a kindergarten school to teach people to teach kindergarten, which had evolved into an early childhood school. I finally found my place. But across the street, when I was looking for a place to go, was Simmons College, and they had a social work program. And I was kind of torn. I was like, well, which one should I do? One across the street, the other, and I decided on early childhood. And then when I completed my master's degree in early childhood, I realized that there was very little in the way of a future for someone with a master's in early childhood in terms of income. In terms of opportunity that was there. I could work in child care centers, and I did. And because I had the master's, was given the job of assistant director instead of teacher. But I was the assistant director at a child care center, and I loved it. I just loved it, but it was part-time, Stephanie. It didn't even offer me 8 hours of work a day. It offered me about 4. They had shifts, and so I had to get a different job. And at a certain point, I had the opportunity to move into a different field. And that field was child welfare. And to study, I had the opportunity to step in to the earliest years of understanding what's called child abuse and neglect and maltreatment of children. And I became a researcher in early childhood and in family development. So my life kind of took a right turn, and I went into a different field, but always with the early childhood lens and always with the eye on supporting families in settings like childcare centers, like the home with parents. So I studied I did research for a group of Harvard University professors for about 3 years, and I learned an enormous amount. And then I stayed in that profession for quite a few years until I returned to early childhood to be the director. I moved up from assistant director to be a director, but that was here in New Jersey.
You know,
Oh,
I
I
thought,
tell you, I've gone like a crooked path, but I've gotten there.
I was going to say, the only analogy I could think of was, you know, your professional life was like early childhood Barbie, where one day you're an astronaut, one day you're a doctor, one, you know, in the
It's
sense
true.
of like,
It's true.
you,
I tried everything. I stepped my
yes,
toe into everything. And I was trying to be a healthcare organizer too in Boston. I tried everything. I wanted to get involved and you know, I think you throw things until they stick. And you know, my child welfare work informed everything that I did. But when I became the director of the Montclair Community Pre-K in 2001, that really stuck. That was where I was meant to be.
and with always the undercurrent of you early childhood as you know, what you wanted to do as your passion.
Yeah. And also early childhood as a way to be the most supportive place for children and their families. So I had seen the other side of that, which is when children aren't supported, when parents aren't supported, children are harmed, parents have to be separated, children have to be separated from their parents. I saw all of that, and I knew that the Early Childhood Center could be the place that prevented a lot of those things, that helped to prevent by being the place of nurturing, education, and caring.
Yes, and that whole idea of going back to that early experience when you were 17 and thinking about the memories that brought up. And, you know, in addition to that little worm, it was the teamwork. It was the teamwork. And I'm just curious to know how that informed your work as a child care center director, that whole focus on the support of families and the idea of teamwork undergirding a great early child care environment. Can you talk to us about that?
Yes, and you know, you know, over these 6 years of working as program director, it has really reinforced for me a lot of the things that I was trying to do in the early 2000s that are now, you know, being standardized for early childhood, and it's gratifying. I will say that. But one of the things we did do at our center was um, we made sure that every classroom was seen as a team, that there were two teachers in the classroom. They each had titles, for instance, but I tried to become more democratic in the titles and underscore the importance of having two people in the room. And, you know, even today, with school districts taking on preschool as you know, part of their offering in public education, this whole idea of team teaching has to be reevaluated and looked at. The districts need to understand that an early childhood classroom is solely dependent on having two people in the room. You cannot have just one, you know, and we were talking yesterday about this, that, you know, like a fourth grade classroom might have one teacher and maybe someone else comes in to assist with a student. That is not how it works in early childhood. It's teamwork. So there was in the classroom, Lori, to answer your question, that really was at the basis of it, is making sure that all the staff who worked in the classrooms felt that they had a role and that they were important to the flow of that class. So that was first. And then second, there was, you know, you're not able to pay a lot of income for staff in childcare. However, there were other ways that we tried to offer staff the kinds of environments and the kinds of benefits that they may feel more included. And we included them in a lot of decisions that got made and, you know, how the school was run.
Yeah, I think that you've highlighted something that is so incredibly important. And it's something that we frequently hear from our successful programs is it's that whole idea of the community culture and the center culture and that feeling of belonging, that feeling of teamwork, that feeling of no matter my position here, I have a voice. When you have leadership that truly believes that we work as a community to support our children and families, and that we are all part of providing the highest quality that we can for children, and that no matter what position you have, the ability of you to be able to do it to excellence, that the support that comes from recognizing that everybody has a very important role to play in making this program the very best that it could possibly be.
Yeah, and it's motivating. So I found that holding this whole center, including myself, to a standard. And by the way, I mean, we had NACE at the time. We were NACE
Okay.
accredited, so we were holding ourselves to that standard, which is very similar, of course, to Grow NJ Kids standards. They're nationally accepted standards. But by motivating people to say there are these set standards and we're going to do everything we can every day to maintain those standards. So, for instance, I would never expect anything of anyone in the center that I wasn't willing to do. I did not go in and teach in classrooms. However, it's not that I was unwilling. I always wanted to make sure that we had, teachers in the room. But I was willing to do almost anything to keep the center open and running. Another thing that we emphasized was acceptance. We were welcoming to everybody who walked into that building. Okay, and this was not post 9/11. I will say exactly post 9/11 because I started on 9/10 or something, 9/9, 2001. So we still wanted to maintain that welcoming atmosphere within the confines of feeling safe. But people always commented to us about how welcomed they felt like as soon as you walked in, you were buzzed in, somebody would greet you and say hello and ask after you. I don't think people with young children feel welcome all the time. They don't. People see someone walk in with a little child in stores or in other places, and sometimes people aren't that friendly. So one of the things that we tried to do is make everyone feel welcome and feel that there was a pride to the school, and they would then adopt that pride as well. The children and the families all felt pride, and pride's an important thing to have.
Yeah. Thinking and reminiscing about, when you were younger and seeing your parents do the work, and then you growing up in the professional field doing the work, and now as a program director, how do you feel about strategies that still work today, still ring true today about children and families? How can we be successful with what your dad has taught you back then and your parents have taught you back then until now? Are there still things that ring true that we can help our families and our children be successful?
Yeah, I think that relationships, right, Stephanie? I think that was at the cornerstone of my family's activism back then. They made relationships with all different kinds of people in our community. And my father's relationship, he was, as I said, a pediatrician, but his relationship with his patients was unique. He was, of course, back then he did house calls. So he got to know everybody's home. He walked right in, no matter what time, sometimes the middle of the night. My father would go out in the middle of the night and make house calls to people's homes. So that's a unique relationship. We have our home visiting today. Well, a lot of that was probably, shaped around the old-fashioned house call that a doctor used to make. And they really knew the family. They knew who was up at 2 a.m. and who wasn't, and what was going on. So relationships was something, and basing the work that you do on the types of relationships that you have. Another thing I learned from my mother was something called networking. Back in everyone talks about networking, but back when she was doing it, she was really facilitating different disciplines, getting to know each other. And she did that through making relationships. And it really helped. She was one who really early on called for there to be services for families and children in schools. like merging those two fields, like the mental health field and the education field. She was always one to network. And networking and relationship building are two things that today our Grow NJ Kids Enrolled Centers can really benefit. One is networking with their outer community, with the people who are outside of their center, who's in your community, and who can you network with. For instance, one thing that I believed in early childhood and running the center was that children that age, and this could be controversial, didn't need to go on buses to go on a trip. They're little children. There is so much within 20 steps of your center, or even a few blocks of your center, that would interest children. An empty lot might interest children. So right in our neighborhood, for instance, they knocked down a famous building in the middle of Montclair called the Haynes Building. And we took the children over and they watched them knock down the building. Do you think there was anything more fun than walking over and watching them knock down a building? And then we watched them build a garage right across the street from our childcare center. Children's environments are what it has to be relevant to them. Getting on a bus and driving for an hour to go pick an apple isn't really relevant to the child's experience. So I did learn early on, and I learned this from a famous educator named Lillian Katz. And if you look up Lillian Katz and you read some of her work, she is very, very focused on what is the purpose of what you're doing. What's the purpose of taking these children there? What's the purpose of having this kind of material in your classroom? And I learned over the years at the child care center that following the interests of the children was the best way to reach educational success in early childhood. And of course, now you see all these curriculum that are written very much from that point of view. High scope, teaching strategies are all written from the child emergent view.
I was just going to say too, what you just said about, intentionality, but also using the child's environment to kind of have them lead you into their world and their discussion. And
Exactly.
I think we are trying our best as, educators who are teaching educators to do that. So I think that's a really good point.
Well, and the educator themselves has to be able to give up a certain amount of control when it comes to being someone who adopts that type of curriculum. And I do want to mention that when I came to the Montclair Community Pre-K, they had already been using a curriculum that was based on the work of Dr. Howard Gardner at Harvard, and he talks a lot about the 8 areas of intelligence and the 8 ways people learn, not learning style. It's more than that. It's more about someone's approach to learning. And the preschool had already adopted this approach, and every classroom used Howard Gardner's 8 areas of intelligence to set up their studies. In teaching strategies, they call it learning studies, or I can't remember what they call it, but we were doing that before teaching strategies that have been written it, by taking the 8 areas of intelligence, finding out what the children knew about a certain subject, and then mapping it on a web and finding activities that fit into those 8 areas of intelligence. And I know you're going to ask me what they are, and I think I can't remember them all. So I'm going to refer people to look up Dr. Howard Gardner and his 8 areas of intelligence and see how you could make that fit into your early childhood classroom, because you can.
Yeah, Eve, I'm just seeing like that whole idea of the linkage. I'm just drawn back to your 17-year-old self and that worm and that idea of following a child's interest that, continued to your time as a child care center director. And I'm just thinking about how that aligns with the Grow New Jersey Kids program and our work at the TA Center, where technical assistance specialists are really following the program's interest. And that, you know, we go in, whether we're working with a family child care provider, a district, a Head Start, a child care center in the community, where we are helping our programs to vulnerably and reflectively look at what they're doing. We're not there to make huge changes and tell them, you know, what to do from a top down, but we're there to come alongside them and help them to figure out what it is they want to work on in order to improve quality and, you know, provide a more robust program for their children and families. And that idea of, yeah, following that interest, you know, do we want to improve this area? Do we want to improve that area? Just so many connections.
Yeah, and I have to say that when I first came aboard, as you said, I came aboard early in the process. I had already knew about quality rating improvement systems, and I was excited because I really have looked for a long time for there to be a standardized way to look at quality in early childhood. I think we need to have some agreements. And that doesn't, though, take away the uniqueness that each center can create for themselves. So I do see the early childhood leader as someone who feels confident of their own philosophy. They're knowledgeable about what quality standards are, and they take those two and put them together to create the culture of that center, as you said. And you know, over the years, you know, I've been able to see from both sides. So when I hear about the Grow NJ Kid standards and about TA, I can also step back and think about, well, what would it have been like for me as a director, you know, to enroll in Grow NJ Kids? And I can see both sides now. I don't know that I could have when I was a director as easily as I do now from taking on this role as the program director. But one thing I do see it as an opportunity. I see it as an opportunity to do your own work on your, you know, look at yourself and say, what kind of center do we want to be? Not what kind of center does my TA want us to be? Not what kind of center does DFD want us to be, the Division of Family Development, or not what we call the rating, New Jersey Quality Rating Center wants me to be, but what do we want to be? And I believe we have, in our TA center in the North, created that atmosphere of the TAs asking and working, as you said, I like the term, alongside the director to examine that and find out and see where what they are doing fits with the Grow NJ Kids standards. For me, having an early childhood system that brings together all of the different types of ways that people provide care, nurturance, and education to children under 5 is crucial at this point. It's crucial. And we've been moving this direction for over 20 years. And New Jersey was a leader in providing public preschool education, and we want to remain a leader. And in order to remain a leader, we have to take seriously our commitment to educating young children in any environment that they're in and supporting the people who do that. And Grow NJ Kids is a support. I want to emphasize to directors and those who are involved in Grow NJ Kids that it is not something that is being placed over you, on top of you, to weigh you down or to burden you. It is there for you to support you and give you the opportunity to examine your own practice. And you do have a practice. Early childhood is a practice. It is something you can work on, get better at, and enjoy. Bottom line, enjoy.
Early childhood as a practice. I'm gonna steal that. That's fantastic. I really love that. Being a program director and being so involved in early childhood in the field, seeing all the facets of this work, is there one area you think we've become so successful and we've come so far? And then what's an area where you feel like we haven't moved the mark yet and we need more practice on, more to work more on?
Yeah, I mean, I think we have, as I said, come so far in starting to standardize practice. But however, I don't like to use but. However, um, we need to work more to unify. We need to unify ourselves. We are not like, oh, I am a public preschool teacher. Oh, I am a private center provider. I am a home provider. I work at a Head Start. We all do the same thing. We all have similar goals. Um, I think we've come a long way in a lot of ways in terms of that. I think we've also come a long way in seeing the type of professionalism that is necessary in order to provide quality early childhood. The idea of professionalism in our field has been controversial for years and years, decades. How we are viewed by the public is a challenge. And once you're viewed by the public, that's easy to take on the mantle of whatever they put on you. And when you have people in the public eye not recognizing the worth of the work that we do, and that has been true over the years. So I have hope, Stephanie, because right now the national conversation is going the other way. And people are using the term child care. They are substituting daycare. And because the reason I've emphasized so much language is that the word daycare, the phrase, was used to separate mothers who worked from mothers who didn't. And it had a negative connotation for a long time by saying, well, your children have to go to daycare, was a way to separate ourselves from others who didn't have to for whatever reason or didn't choose to. So when we use a more neutral term like childcare, we can get at the fact that we all families need their children to be enrolled in quality programs that will enhance their learning and provide quality environments. So I think we have come a long way. And the fact that a federal bill that's being considered in Congress right now has already passed one house of Congress has in it provisions for universal preschool and for supporting childcare and childcare providers is historical. Even if it's, and I know we're in the midst of right now trying to get seeing what happens. However, the fact that it's even written into the law is brand new, since it hasn't been anything like that since, and I will tell you, 1968. So if you look at how many years ago that was, and you can all do the math, nobody's mentioned childcare. It's only been mentioned under the guise of Head Start or community block grants. But it's so much more than just a community block grant issue. It goes to much wider public. And, it's unfortunate that a pandemic, a serious challenge to our safety and health, had to underscore the need for quality childcare, but that's what happened. So I do see hope. And I also see that those of us who've labored long and hard in this field getting recognition. And our family care providers, our child care directors are finally getting recognized as the community resource that they have always been, and being appreciated for the struggle that comes with opening a center.
Mm-hmm.
Okay, I talked a little too long there. Sorry.
No, Eve, like what you said just resonated so much. And I know you and I have talked before as two well-seasoned professionals. We have been in this field for a long time, and we have had the privilege of seeing the needle moving. And especially, as you said, in the last 20 years, the hope that we hold for a better day, in spite of the temporary and temporary challenges that we are facing right now in a very trying worldwide pandemic. There is so much hope because the incredibly important work of the early childhood workforce is finally being recognized and celebrated and looked at and supported. And I know that we still have a ways to go, but we are moving in the right direction, which brings me so much hope as well.
Yeah, I agree. And I think that Growing J Kids provides some of that hope. And it is my belief that going forward, an early childhood rating system will enhance everyone. Right now, you can choose to enroll. It is not required. However, looking to the future, I believe these standards will be in place if you want to open a center. And that's what we need. We need people who are going to all agree to a certain level of quality when you open any type of program for children birth to age 5. I also hope, by the way, that another thing that will happen is we will start becoming more connected with the prenatal community, the community that takes care of families before they become a family. And, I say this all the time, but it's so important to have not only a birth plan, but a child care plan. So, we work very hard to help expectant parents work out how they're going to have this child, where they're going to have this child, what kind of birth they want to have, or even if they're adopting a child, what is going to happen around that part of it. However, we don't go to the next part, which is, well, how will you as a family work out your child care plans? Because everybody needs them. Even if you're at home with your child, you need other people on whom you can rely at stressful times. I think there's people on this call right now who can relate to the fact that they weren't expecting something to happen to their child, and they needed support, they needed help. So a child care plan can help you do that, because it's not just a child care center, it's on whom can I rely when situation A comes up, situation B comes up. And I talked a lot to parents about this when I ran a child care center, about having the backups, always having the backups. But a child care plan, I'm hoping that we can include the prenatal health community and others in joining together with the early childhood community to create an entire ring of safety for these families. That's what they deserve. That's what they should have.
I have a question that could push a button for you, but I think this is good. This is where we should bring this out. Speaking of the importance of connections and importance of childcare, what do you say to someone who undermines or minimizes the role that a really good quality center or a quality teacher can play in the life of a family or a child?
Well, it would depend on what they actually said. However, what I would try to do is discuss my experience of having run a center, and how often I hear from the parents who had their children there, even after their children are beyond college, and they will stop me in the street. They will talk to me. I just saw one the other day in the supermarket who stopped me. I mean, I had my mask on. I had 2 masks on, let's be honest. And she stopped me to tell me how meaningful it was to her that I taught her children, or had her children at the child care center. And then when they graduated high school, I signed their diplomas because I was on the Board of Education. And she started to tear up, telling me how much it meant to her to have the support that we gave at her early childhood center for the rest of her child's time, getting through school. So those are anecdotal. You can also, cite literature that tells the same story. I think you can cite instances of families who were impacted by Head Start in such a way that the parents themselves are now early childhood educators because they were welcomed into the early childhood center at Head Starts. I think that you won't always convince everyone. I think that what else is out there to convince them, but not everybody is ever convinced by science, as we well know. But there's science now that also is quite convincing, that tells a lot about brain development and the impact of brain development in the early years. And even just talking about that can sometimes sway people, but not all people. And I don't expect to. Dr. Howard Gardner, just to bring him back into the conversation, he came to visit our early childhood center. We actually had a visit with Dr. Howard Gardner. He looked through our whole school and he talked to our teachers. And one of the teachers asked that exact question, Stephanie, what do we say to parents who say, you're not teaching my child anything? I want my child to know their colors and their ABCs, and why aren't they learning that? And Dr. Gardner looked us all in the face and he said, your school is not for everyone. And that really resonated for me because, the truth is, you can't be everything for everybody. And if somebody is not convinced by the experience their child is having that it is worthwhile, then our school is not for you. It helped me. It freed me. It freed me because I said, I have to be confident in who we are, this whole team of people, and what we represent as a center. And you are free to go somewhere else. Mm-hmm. Now, hopefully, the somewhere else will also have quality as well, but maybe not.
Oh gosh, Eve, this has been such an amazing conversation. And I love that Stephanie brought it back to the connection and the relationship. And then Dr. Howard Gardner. So I'm thinking back to your father, the doctor, and how we kind of started this conversation talking about the importance that he placed on relationships. And I'm just kind of drawing the connection between what we hear from our programs, our providers, our directors, our teachers, participation in Grow New Jersey Kids, and how important that relationship is, that they first develop with their quality improvement specialist and then they develop with their technical assistance specialist, and that in spite of the different kinds of perks and benefits to being part of Grow New Jersey Kids, that many programs feel that relationship is the thing that is so important. And then I'm also thinking about what you said about making that connection with prenatal and how I see the silver lining in this pandemic is that we have been able to deepen, strengthen, and create new connections with various parts of the field that support children and families through education, through healthcare, through child welfare, because suddenly we're able to be part of groups that would have taken all day to drive to and from a meeting across
That's
the
right.
state. Yeah, so I see that in spite of our need for some social distancing at this time, we are becoming more connected and more relationship based in a way that looks so hopeful to becoming a more comprehensive and cohesive system supporting all of New Jersey's children and families moving forward.
Yeah, and I hope that providers will take from this that they're not alone. They are not alone, that so many are facing similar challenges, and that one thing our TA center can offer you is to break out of that isolation and share. And the TA can guide that. They can offer you peer learning communities. They can offer you opportunities hear from others about how they may be handling some of the day-to-day kind of things that I know we all know people are facing. But our TAs are very mindful and thoughtful about their role. And to me, it's so important that the wider community understand our role, and we are not there to dictate, and we are not there to criticize. We are there to support.
I will say this conversation has recharged my battery when it comes to, being inspired and having the sense of just wanting to do more with networking and activism and mental health, and just wanting to learn more. And if this conversation brings nothing else, I would hope it would tell people, do I know enough? Am I doing enough for my families and children? Am I listening enough or hearing enough from people? So this was just a wonderful conversation, and so relevant to what we're going through now.
Isn't that nice? That's great. I mean, I think about those things all the time. And, there are, I'm teaching a course right now on how to be an advocate for children. And, there are many different styles. Advocacy comes in different ways and in different styles. And if you are a preschool or a child care director, there are so many things you can do. People think advocacy is being adversarial. It's not. It's being, it's finding a way to give voice to what's going on. And I think that child care directors are in a unique spot to do that, because I admire them, I respect them, and I think they do an awesome, awesome job.
Love that.
Thank you so much, Eve. This has been so enlightening and, as Stephanie said, so inspiring. We are so blessed to have you as the leader of our Technical Assistance Center. I think that you bring that concept and that deep knowledge of teamwork to our team, and we are really grateful. So thank you so much for joining us today.
You're welcome. It was my pleasure. Take care.